Come again. I heard from you and many others saying red light can fix your gut, boost your brain, and even lift your mood. Is this light magic or legit science? I'm looking forward to finding this out with the famous rebel scientist herself, Sarah, the founder of Sarah Thrive. Sarah, welcome again.
Thank you so much, Kanzu. I'm also looking forward to talking to you.
Perfect title for No BS. I have to ask you this question. Why light? If you had to explain red light therapy to a 5-year-old, why should anyone care about shining light on their gut and brain? What's actually happening in there?
That's a big question. And I think it's something we have known for centuries how connected we are to the life-giving force of the sun and how important that is. Most 5-year-olds probably know it better than most adults. Most 5-year-olds, what do they want to do? They want to be outside and play all the time. They understand the importance of that intuitively. I think what we're doing with a lot of this technology is just trying to move us back a little to how our bodies have evolved and how we really function on this planet. So light is hugely underrated and hugely important.
We are afraid of the sun these days.
It's ridiculous how the sun has been demonized. And actually, it's life. I was on a lecture yesterday by the Guy Foundation, and there was a dermatologist talking about how he discovered that when we're exposed to sunlight, we generate nitric oxide in our bodies. This is well established now, and one of the mechanisms of red light therapy. And he presented it. He was like, oh my goodness, this is going to totally change dermatology because people are used to saying stay out of the sun when actually we really need to be in the sun. It's hugely important. And he said that he had nobody come to his lecture. He was actually referring to UV light, which is different to the light I'm going to talk about. It's at the other end of the spectrum. We see UV light mainly in the middle of the day. But the sun has full spectrum. So, you know, when we say, oh, red light in the morning and UV, we're missing the point that the sun has all spectrums. It's just the proportions. So you can get UV light in the morning along with near infrared. It's just a different percentage. It's mainly red in the morning and then mainly UV in the middle of the day. These are hugely important physiological functions of light that for whatever reason, probably the rise of the drug industry, we've factored out of our health programs and demonized the sun because we've had different messaging. The sun's linked to cancer. He presented some amazing data showing that the effect of sun exposure on some of these other big conditions, focusing on cardiovascular, far outweighs the risk that some people develop melanomas. So we focus on one thing and then base all our advice around that, completely
Leave out the good stuff.
This is probably one of the biggest mistakes of medicine, to demonize the sun and to keep people out of the sun, especially children. We put toxic sun cream on our bodies to block out the healing rays of the sun. We're in a very ridiculous period of history. I almost feel like sometimes we're in the dark ages again. Why would you put toxic cream that's full of parabens on your body to block out the healing rays of the sun? It doesn't make any sense at all. I haven't used sunscreen for 12 years now. I'm a fair English, and it's about how you build up your tolerance to the sun. The body's so clever. When we see the red light in the middle of the day, you're preparing your body for that exposure of UV.
Yeah, you're right.
The body is so smart. We have to work with the body, not against it. Most of the time, people who burn or get melanomas go straight out in the middle of the day. They haven't prepared their body by seeing the red light in the morning. And that's when your body becomes damaged. So I think the more we can in tune with nature, the more we understand it, some of these misnomers we have in the medical paradigm will be resolved.
What do you think are some of the biggest BS in this market right now, in this wellness market right now that we are in? You are someone that goes to most of these top conferences and you see a lot. You're probably up to date with everything.
Yeah, I do a lot of events.
Seeing everything, meeting all these people,
Yes.
and obviously like you have this amazing product, so you get to engage with the real people as well. So what are your insights on the market? How do you see it? What are some of the biggest fusses, like biggest BS in this?
I don't know if I would call it BS because some of these, I mean, in the wellness, anything where people are focusing on wellness, I'm not into the sick paradigm where we're using pharmaceuticals which are toxic, but anyone who's trying to bring in wellness, so bringing something that's going to overall potentially raise your level of wellness. To me, the biggest BS is the pharmaceutical industry for chronic illness. We really should be done with that paradigm by now. But in the wellness industry, I also think, because you're right, I'm at a lot of these events, people who are focusing on one particular nutrient or
Right.
one particular peptide or one
One
particular
magic
test.
pill.
I think for most people, we just need to master the basics. If you really want to move the needle on your health, going to bed early, getting enough sleep, being outside as soon as you wake up, prioritizing good connections, prioritizing community, also doing a bit of self-examining. Do you have meaning in your life? Are you really passionate about what you do? Are you giving it 100%? I see a lot of people in this industry, and when I speak to them, they're burnt out, they're going through a divorce, they're struggling to fit in their own biohacks because they're so consumed with work. It's not that it's BS. I think people really just need to focus on the basics first. Then we can do these little tweaks, this certain peptide that's going to have a certain effect. But without doing the groundwork, it's not going to shift anything. You need to do the basics first. And I think that's where people sometimes have a block, because it's all too easy to go to an event and you've got some hydrolyzed collagen that's it. That's going to do it for you. Yeah, I don't know.
Yeah, I appreciate your honest answer to that. I have to talk about Sarah Thrive a little bit. And this is not like a product marketing platform, but I think it's super interesting that connection that you quote between gut and the brain and how you're fixing that connection through red light. What moment made you realize light isn't just tech, but it's like medicine? And can you talk a little bit about gut and brain and how red light gets into action there and heals us?
For sure. I've always been a sun worshipper. I've always intuitively known how good the sun makes you feel. Being out in the sun. I'm from England, so any chance. That's like, but actually, it wasn't until I was involved in the nascent biohacking movement, probably like 12 years ago, started in California. I was living in California at the time.
Okay.
And
I
I
did.
met Dr. Jack Cruz at the start of that journey. He very much advocates the healing power of light and sunlight. And I was very fortunate at the time to be in a place where I could actually meet a lot of the people who were starting to talk about this. So Professor Jerry Pollock, who was just starting to investigate how light interacts with water. And for me, that was the turning point, because once you understand how light interacts with water, you begin to have a whole different perspective on
Can you
biology.
tell us a little bit about that as well?
Sure. And also, if people don't know much about it, I recommend the book Fourth Phase of Water, which is Jerry Pollock's book on the subject. It sounds complex, but it's not. It's very friendly. He has examples like, how do you know the steam coming off your cup of tea, or how does a ship go through water? If people are put off by the title, it's not at all just hard
Super
science.
interesting. I will definitely check it out.
But the basics are that we all know water. If you run a bath, your water's H2O. That's what we call bulk water. But actually, when you have what they call a hydrophilic surface, that just means water loving, something like a cell membrane. When
Mhm.
you have that and you shine light onto the water that's next to that surface, water does a very interesting thing, and it starts to become ordered. And it's a bit like ice. Ice is just ordered water. That's why ice is hard. Ice is hexagons joined together in sheets. Those sheets are bonded very strongly. So ice is a very strong, but you slip on it because it's sheets. So you can hit a sheet and it will slip over the other sheet in non-cold conditions. You also form these sheets. So you have slippy water, but without the bonding. So next to a cell membrane, you have a layer of, it's almost like a gel. They call it a gel phase. So you have solid, liquid, gas, and now gel. And you can imagine how that helps to lubricate the blood vessels. So all of a sudden, you have this slippy surface where you have greater blood flow. Every protein in your body is surrounded by water, and proteins fold because they have charges on them. So this water also, because it's charge separated, helps proteins to fold. It helps little rotors in your body that make ATP, because when you look at how the body actually makes energy, it does use an actual spinning motor. Little molecular machines. They all work better if they're covered in this more viscous water. It's mind blowing when you apply that to things like how the brain works, how the gut works, because now you have a way that the body has more energy and is so much more efficient
Wow.
because the water is slightly different. And it's even a different chemical structure. It's H3O2 because of the way the bonding is. It's no longer H2O.
Wow.
It's, I think it's probably
It's
one of
really
the mind blowing. And also, it's mind blowing that it's not yet really accepted science in biology. So it's still very fringe. If you talk to people in the mainstream about structured water, they really don't know anything about it at all and are very reticent to even talk about it. But there are some people, especially in this growing field of quantum biology, who are prepared to talk about it because it has implications for quantum biology, because of course it's to do with charge, and anything to do with charge has that aspect. For me, that's what got me most excited in light as a therapeutic, because I began to see how light actually is the foundation for biology, and specifically in humans or in any animal, how that light interacts with water. We are mainly water. We're 99% water molecules, actually. It's staggering. How light interacts with the human body is probably the main thing that we should be looking at. If we focused our attention there, I think we would find solutions to a whole lot of conditions and things that are happening in the body. So after discovering that 10 years ago, the rest of my life, I am determined to focus on
Wow.
healing effects of light.
So like with Sarah Tribe, obviously like you have that brain piece, the headset, and then you have for your gut, like how tell us a little bit more about how they work together. What's the flow
Yeah,
like?
absolutely. My background is clinical neuroscience. When I started learning about how light structures water, my first thought was the brain. The brain is mainly water. Why aren't we doing it to the brain? But actually, the brain is in this hard case. We have a skull that there is a little bit of a barrier to getting light there. Probably only about 3% of the light we shine on the head actually gets through to the cortex. I started thinking about this whole systemic effect of light. And actually, the gut is a very good, very accessible area. And there's a lot of stuff you can access there. We call the gut the second brain. I call it the first brain. Developmentally, it's the first brain. There are a lot more signals going from our gut brain to our brain because this is where we sense our environment. This is where so much is going on. Most people now have chronic inflammation in their bodies because they have leaky gut. So if you heal the gut, you reduce systemic inflammation in the body and you reduce neuroinflammation. So to my mind, it makes top sense to heal the gut while you're trying to heal the brain. And that's what I've found after making this device where I target both. Most people don't even remember that they have gut symptoms. Most people just take it for granted that they sometimes have bloating, that they sometimes have problems going to the toilet, all of these things. And you're like, no, that's not the norm. And when it's healed and gone away, they're like, oh, yeah, my gut feels better. And now I can think better. The body,
Target gone. Yes.
I'm not so stressed. I'm more resilient. I'm finding I have better relationships in my family because I'm not so reactive. So healing the gut to heal the brain makes perfect sense to me. And you're right. I use a dual device system. So I apply the red light and near infrared. It's important to say it's not just red because it's the near infrared that goes deep into the body.
Near infrared for the gut.
So we say red light therapy is a catch-all, but actually near infrared is invisible. It's just beyond that red spectrum. It's a longer wave, so into
Goes
the body.
deeper.
Yeah. So you need to have both. But if you use near infrared, you're able to heal the gut. You can.
The belt you have is near infrared.
Yes. Let me show you because maybe people don't quite understand. See, here we have red. Oh, I've got the fade on. It looks like you have red and then nothing, red and then nothing. But actually, the near infrared is just as bright. We just can't see it with our eyes. Our brains are not programmed to
And by
see.
the way, it's not bad for the eye. Just want to also note.
It's not bad for the eyes. And in fact, the FDA have now granted a license to a company that are treating macular degeneration using near infrared.
Okay.
But I don't advocate staring into any of these lights. Don't try and self-treat. Because although it's not bad for the eyes, it can be tiring to look at any bright light. And they're not designed,
Right.
devices, any panels, any of these things are not designed for you to stare into them.
Anyway,
But
so this is the near infrared.
so near infrared, it will go straight through the body. It can target the integrity of the gut. Once you help the gut to heal from leaky gut, you stop metabolites and food and things going into the bloodstream. And that's the main source of inflammation in the body. If you have inflammation in your gut, you're going to have it in your brain. Reducing inflammation is a huge part of how red light therapy is working.
And all those supplement lowers, I feel like once you heal that part, your body can also
Yes.
make use of supplements better, correct?
If your gut is leaky and you're taking all these expensive supplements, you are literally flushing them down the toilet because you can't absorb them. You need to heal the gut first as a
Absorption.
priority. We do know that once you have a healthy gut, you have healthy microbiome. And of course, that's another thing that everybody's just started to realize, that the
So could you
microbiome.
not take probiotics, but just use this device and it will do the same thing for you?
Well, you again, the probiotics are only as good as how healthy your gut is. I'm also not a fan of taking a lot of probiotics because you're only giving the gut those specific probiotics that are in that formulation, and you're blasting your gut with billions of these external probiotics.
They say prebiotics are more important than probiotics.
I think so, because what you really want to do is have a good environment in your gut and let your body populate it with the bacteria that it wants.
Yeah.
There are so many different species of bacteria. We shouldn't be giving the body just one species, even if it is a hugely beneficial one. I do take probiotics every now and then. I do have one that was recommended, but I don't take them all the time. I prioritize just having a healthy gut over artificially giving myself the bacteria that I'm thinking the body might need. I think this comes back to respecting the body. Heal the body, be as strong as you can, and the body will do its thing.
So when you combine that near-infrared light on your gut with the headset that you have, which is not near-infrared, right? It's infrared light. Is
It's
it?
infrared. Yeah, we call it near infrared because it's longer wave than we can see.
Okay, so both are the same.
They're both the same. The one on the head, I actually have different wavelengths. They're both near infrared, but on the head, I'm really going for that effect we spoke about before with the water. And the longer the wave, actually, the more water starts to absorb that light. So water starts to absorb above 900 nanometers, which is fairly long wave.
So when you apply these lights to these areas both at the same time, they work better.
They work better because you're reducing inflammation with the body panel, and the body is sending the message to the brain, it's time to heal. We're getting a lot of exposure to red light because that's when you would normally heal. At sunrise, when you see the red light, your body's preparing itself for the day. So it's releasing all those hormones and chemicals that helps you get ready for what you might do in the day. And then in the evening, you see the red light and it's producing all those things that help you sleep and repair the body. The gut will send a message to the brain, okay, we're getting some near infrared. It's time to switch on healing. At the same time, you're having the light on the brain, a small amount, but enough to also activate those messages in the brain. So you're having that combined effect. It's also a psychological effect. You want to understand the gut brain connection. So I also deliberately designed it so that you do both at the same time. And you'll see in my app, I have some meditations to help you make that internal.
I usually do them before going to bed. In the morning, I usually get better scores.
For sure, because the body, like I say, once you give the body the energy it needs, the signals it needs, it will start to do its own thing. And better sleep is one of the main effects of red light therapy. And it's probably one of the most important things you can do for yourself. The brain flushes overnight. There's so much stuff that's going on in our sleep. It's not just we're closing our eyes and just feeling refreshed in the morning. No, there's a lot of processes. All those processes need energy, by the way. You need a lot of energy to sleep. So charging your mitochondria, having a lot of ATP, having those healing messages are crucial, really.
Yeah, I can tell the difference because, yeah, and also like another reason why maybe people feel better in the summer than winter because they're more exposed to the sun. So I have this no BS chat, which is a rapid fire BS or
Right.
no BS questions, like quick 5, 6 questions. Are you
Ready? I'm ready.
okay? One, you can get the same benefits from sunlight, BS or no BS?
As red light therapy?
Yes, as red light.
No BS. No BS. I always say to people, the best thing you can do is be up every morning at sunrise and see the sunrise and see the sunset. That's not BS at all. It's just, unfortunately, most of us can't or won't do that.
Great. Second question. Infrared saunas are just expensive sweat boxes. BS or no BS?
No BS. Saunas are great. Saunas activate a different mechanism. They're infrared saunas, super cool, but it's slightly different. It's not the same infrared as you get in these devices. It's much longer wave, so the body experiences it as heat. It's normally above 3000 nanometers to have heat in the body. These ones are much shorter wave. But
Interesting.
take your device into the sauna and you have double whammy.
Red light helps with depression.
No BS. That's been proven. There's a group in Harvard under Dr. Paolo Casano that are looking at red light specifically for psychiatric conditions, and they're getting great results.
Next, you can overdo light therapy. BS or no BS?
Again, I'm going to say no BS because you can overdo it, but you really would have to go for it to overdo it, because a lot of these devices are fairly low power. You would have to sit with it on all day to overdo it. When we say overdo it, it's not that you're going to have particular side effects, but you might negate the effect. Imagine you're charging your mitochondria and your body's really working well. If you start to generate more waste products than your body can deal with, then you negate the effect. So that's overdoing it a little bit. You need to be sensible.
Okay, cool. Next, we'll all have red light devices in our homes in 5 years. BS or no BS? Is it
No
gonna be-
BS. I think it's the medicine of the future. I really do. And every time I go to a different talk on it, I'm more inspired. People are also questioning windows that filter out all these lights. Are we going to change that so we have windows that let in the healing light? Are we all going to have red light around and change our light bulbs? I think so. So I'm hopeful that that's no BS. If I have to project into the future, what would I like to see? I'd like to see that.
Love it. Before we close, I love to end this with a nice note. So I will ask you one last question, which is you call yourself a rebel scientist. What's one scientific rule you love breaking, and what's the reaction from the traditional science crowd?
Quite often I am speaking to medical people and I'm talking about shining light onto the brain, and instantly for most people they don't want to know, because most doctors think that it's dark inside your brain. I keep on pushing about that. Not only is it not dark inside your brain, but your brain is also emitting light. How crazy is that? And so I totally do rebel against this mainstream way of thinking that you need somebody else to fix you and that you can't fix yourself. I totally rebel, and I'm constantly doing it. Even my dad, for example, is just had a motorbike accident, but he won't do anything unless the doctor tells him to do it. And so I'm constantly pushing against that. That's where the rebellion comes in. The rebellion is you have to take control of your own health. Nobody's going to know you better than you. And also where there's an agenda, where the doctors are, they're being trained by a pharmaceutical company, you have to question that. That's where my rebellious nature comes in mainly, is rebelling against anybody being told what to do and not taking responsibility. If you research it and you say, no, I really think this drug is good for me, then great, go for it. But just don't do something because someone tells you to do it.
I love it. Thank you so much.
Yeah, it's such a pleasure. It's always a pleasure to talk to you. So thank you for having me on.